Dr. John Nkengasong, director of the Africa CDC, told VOA to have a reasonably accurate picture of how the disease is spreading, Africa needs about 15 million tests, or enough to test about 1% of the population. To date, only 1.8 million people have been tested continent-wide.
If we do not know a pandemic, we cannot fight a pandemic. It's like we're at war. If you do not know your enemy, you can't fight the enemy.
In order to bridge the testing gap, the Africa CDC has created the Partnership to Accelerate COVID Testing. The partnership will establish a platform for African countries to pool resources in order to buy diagnostic tools available on the international market. Nkengasong hopes the platform will go live in about a week. To date, the Africa CDC has distributed about 2.7 million tests and has plans to distribute about 900,000 in Senegal this week. Still, Nkengasong said there are many blind spots which affect the accuracy of overall numbers.
There are certain missing cases out there because our surveillance systems are weak, our health systems are weak. We are certainly missing cases there. The real question is by how much? Okay, are we missing it by a whole lot, or are we missing a few cases here and there? So as we increase our testing ability, we'll be able to answer that question. The concern that we have is what we are not seeing going to harm us.
Africa has recorded a lower caseload than other parts of the globe, with about 117,000 cases of COVID-19 infection and about 3,500 deaths. However, in recent weeks, new cases have been increasing at a rate of about 30%. One headline-grabbing example took place in Ghana earlier this month, when more than 500 people tested positive in one day at a fish processing factory.
Now suggests that we are on the increasing side of the slope. So we are not yet at the top of the slope, or we are not decreasing. So I think that has to be put in context. And this implies clearly that we cannot be complacent.
To combat this worrying trend, Nkengasong said the Africa CDC is leading an effort to recruit and train 1 million foot soldiers, or people who can hit the streets to do contact tracing. He also stressed the need to expand health systems to meet the additional need and to protect them from being overloaded.
The harm that if we do not protect our healthcare workers, that it may have on our overall ability to provide care for the community is huge. Okay, and this includes the damage that it can cause to our HIV, malaria, tuberculosis, and immunization programs. Yeah. So these are all things that we must, the challenges that we face across the board.
Salem Solomon, VOA News, Washington.